Hello, and welcome to Mature Matters. My name is Cindy Gray, and I'm your host. I'm here today with Helene Rose, and I'm also with Debbie Clark, and both of you work with Botsford Hospital. Hi.
Yes, hello.
How are you today?
Fine, thank you.
Good, good.
Glad to be here.
Thank you. So, Helene, tell me a little bit about what you do. You're a speech pathologist, and you've been a pathologist for 30 years.
Yes,
And what do you do for Botsford right now?
I actually manage the physical therapy and speech pathology departments. I also treat patients anywhere from 2 years of age to over 90.
Okay.
I've specialized in the neurologic population, and I also do the pediatric population.
Oh, okay. So literally from young to older. Okay.
Right.
And then Debbie, tell me about what you do.
I am currently a physician liaison where I go out and give all the physicians the information on what programs are available for physical therapy, occupational therapy, and speech therapy. I am also a licensed physical therapist assistant and a licensed massage therapist, but I don't currently do that at Botsford.
Okay. But I'm sure all the wisdom that you've gleaned from all that comes into play with everything you do.
Yes,
Okay.
it has, very much so.
Okay. So you assist the doctors in knowing what type of programs are available.
Correct.
What type are available to the public?
Well, we do all the traditional therapies at all 5 of our clinic centers, and we have specialty programs as well, which that's the reason we're here. We're going to talk about a program that we've just launched in the
Okay.
last year
All right.
on LSVT Big and Loud.
Okay. Can you say the name of that again more slowly for our members that are watching, our watchers?
LSVT
Okay.
Big and LSVT Loud.
Now, Helene, can you define that for us?
Sure. LSVT stands for Lee Silverman Voice Training.
Okay.
The organization is called LSVT Global, and the speech therapy part is the LSVT Loud, and the physical part of it is LSVT Big.
And the VT stands for voice therapy.
For voice therapy, because
Okay.
that's how the program originated, with a voice program for somebody named Lee Silverman.
So he was a patient, not
He was
a
a
doctor.
patient, correct.
Okay.
And his family wanted a way to communicate with him. So there was some women who developed this specific type of program to work with him. And he had Parkinson's disease.
Okay. And is that who you primarily serve, or people that suffer from that affliction?
Yes, with this particular program, it is designed for Parkinson's patients, but it can also be used with other neurological populations.
Okay. And who might that include, just for our viewers to understand?
Could be a stroke person, could be a heart attack, could be cerebral palsy maybe, a
Okay.
high-level cerebral palsy, multiple sclerosis.
Okay. And these are considered neurological disorders,
Correct.
which can severely impair the speech of a person.
Yes.
And this sort of therapy helps work with them to become more understandable.
It's the focus of this particular program is to get their voice to be louder, because the
Oh.
Parkinson's patients tend to become very quiet when they speak.
Can you tell me why?
The reason is the Parkinson's population has a tendency for their vocal cords to bow.
Okay.
So
They
they bow like this.
the cords.
The vocal cords,
Okay.
vocal cords normally come together,
Okay.
and they open and close like this.
With the breath.
With
and
when
the
you breathe, they
speech?
open and close, and when we voice, that's what makes our voice come out, is the vibrations and the movement of the vocal cords.
Between the cords.
Between the vocal cords, right.
Okay.
So a Parkinson's patient, the vocal cords would bow. So that leaves space for air to come between it, and it ends up making the voice very quiet, sometimes very breathy,
All right.
almost whisper-like.
And are they aware of that when it happens?
Not really.
Okay.
They think they're talking like you or I, but their family members are constantly complaining, I can't hear you, I can't hear you, what did you say?
That must be very frustrating for everyone.
It is. It is,
Right.
because the perception is, I think I'm talking loud, and I'm talking in a normal voice, but they have
Right.
no perception that they're talking quiet. So it becomes a
Wow.
safety issue too.
Oh, yeah.
If they're in one room and a family member's in another room,
And they need help or
and they need
assistance.
help, and they're yelling, help, help, no one is going
Wow.
to come to their aid.
Wow. Okay. This is a whole new world for me. I didn't know that. Okay. So what sort of exercises would you do to help them? Is it projecting?
Kind of. The Lisa Verman Voice Training Program is a very structured program. It differs from traditional therapy because it's a commitment of 4 days a week of therapy, 4 consecutive days a week, I should say, of therapy
Okay.
for 4 weeks straight.
How long is each session?
60 minutes.
Oh, okay.
Every session you essentially do the same thing. There's various exercises where you sustain phonation, which is saying ah, and you want that to be as long as possible. You have them sing up and down the scale
Right.
to maintain some sing-song to the voice.
Okay.
And then you have them either read some sentences and then paragraphs, and then you read stories to make sure you're getting inflectional patterns, to make sure you're getting the loud voice and you're carrying it over from various settings.
So are these patterns that they develop like behavioral patterns that they're not aware of? Or are you actually helping to heal this bowing process?
The whole idea between LSVT, the idea of loud, is you try to teach the patient to think loud and think shout.
Okay.
So throughout every activity we do, I am always asking the patient to, louder, louder, shout.
So they become more conscious
So
of
they
it.
are
So
more
it's an
conscious.
awareness
It's
exercise.
a huge awareness.
Okay.
And so I'm constantly cueing them louder, 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 louder. Shout,
Okay.
shout, shout. So that they can get the concept and they can hear themselves when they're talking louder.
That's amazing. Some of us need therapy to be quieter.
Well, that's true too.
Well, and I was
Who'd have thought?
there observing because I wanted to know about it when I go to tell the docs, and she has an objective measurement where she wants them to stay within a certain range. Is it 60 to 80?
These are decibel?
Yeah,
Decibels.
it's a sound level meter
Oh,
Yes.
okay.
that I actually put out so that the patient can actually see how loud they are. And they can see if it goes too low or if it's going higher.
Now, this is referred then by the person's doctor?
Yes.
Normally?
Yes.
What if someone thinks they might need that? Can they ever come and observe, or can they come and meet with you, or?
It would definitely be possible. I think that they probably should call the specific clinic and just say,
Right.
I'm interested, I want to see what it entails. Would I be able to meet with a therapist for 15 minutes?
Right.
So they can put it down on their schedule and spend the time with them.
Ask
So
some
yes, I think
questions
so.
and-
Very
That's
possible.
fascinating.
We don't
Okay.
always have a patient we're currently doing the program with. Sometimes we do, sometimes we don't. So
Right.
they wouldn't necessarily be able to observe the program. We could more just give them some information.
Okay. And how does it differ from traditional therapy?
Traditional therapy, especially in voice therapy, is trying different techniques to try to get people to use their voice more effectively. It's not necessarily that they're talking very quietly. They might be
Okay.
hoarse. They might have
Okay.
vocal cord nodules or vocal
Oh,
cord polyps.
okay.
So it's more vocal hygiene as well as learning some breathing techniques. And therapy might be 2 times a week.
Do you ever have people, like, do you record it and then have them listen to themselves?
Sometimes.
I
a
think
lot
that
of
would be interesting.
A lot of times people don't like to hear themselves on tape
Right.
because they don't realize how they sound. So we try that sometimes though.
Okay. Wow. All right. What else can you tell me about it? Do you any particular favorite stories or remarkable things that have happened?
You know,
or-
I think the nicest part of the program is that the first day of therapy, you can actually show the patient a difference. So they can hear that they can get a louder voice out.
Okay.
And it's very
So that's
rewarding. It's
encouraging
very
to them.
encouraging for them
Okay.
to do that because to commit to 4 days a week is pretty strenuous. It's an hour, at least an hour, you know, for loud. And if they do the big program also, it's 2 hours of therapy back to back.
Right.
Right.
And how long does it go? How,
For
in
4
general?
for 4 weeks.
4 weeks. Okay.
It's a 4-week program with refreshers as needed.
Okay. And then I was just going to ask you about follow-up after discharge. What does that involve?
We're just kind of getting involved in that, and we're going to probably do some follow-up calls after maybe 3 to 6 months.
Where
to
you
see-
go to them or they come
We'll
to you?
call. We'll make some
Oh,
calls
okay.
and see if people need a refresher or not.
Okay.
So it's a different way of patients to think and to perceive themselves. So it's very exhausting. You know, it's doing things that they haven't done before.
Right.
Okay. And do they get assignments? Do they get homework?
They-
Yes.
There's a specific program that they have to do, a couple times a day from both programs that they're supposed to practice, because the more they practice, hopefully the more things become more of a habit.
Okay. All right.
So-
So this is voice therapy.
Voice
Now, do you do
therapy.
speech therapy too? Are you also a speech therapist
Yes.
specifically?
Correct.
And what would be the difference between that? You said like hoarseness.
Speech, excuse me, speech therapy would be more for somebody who's got slurred speech.
Oh,
Or like with
okay.
the children who can't pronounce their sounds.
Or have stuttering, perhaps?
Or could have stuttering.
Okay.
We do language therapy too, which is somebody who's had a stroke,
Okay.
who can't find their words, who can't read, who can't write.
Okay. I know a long time ago when my mom had a series of strokes, actually, and she lost abilities on particularly one side initially and then ultimately on both, but her speech was severely impaired, and she was so frustrated by it. And I had read that sometimes because of the different hemispheres of the brain and different segments of the brain control different things, one side controls speech,
Right.
whereas the other side controls song.
Right.
And so she would sing what she wanted. We would sing to each other, but not necessarily a song.
Right.
But she would sing a conversation.
That is
Right.
actually a therapy technique,
Okay.
a speech therapy technique called Melodic Intonation therapy, where you use
I didn't know
singing.
I was doing that.
Yep, you were a therapist and you didn't even know it.
Wow.
Well, and another thing that Helene specializes in is voice,
Voice, swallowing.
right?
Oh,
And
okay.
that's a specialty that a lot of speech pathologists don't have, that Helene does have.
Okay, and who would benefit from that? Or what?
Oh, anybody who, sometimes everybody now has acid reflux. Acid reflux can cause irritation to the vocal cords.
Oh, okay.
Drainage, there's been a horrible, horrible winter and a spring.
Okay.
Everybody's got a lot of allergies and drainage. That impacts your vocal cords.
Oh,
So people are getting hoarse, people don't hydrate adequately,
okay.
people eat the wrong foods. And it impacts your voice, your vocal
Right.
cords. Your poor little
I would
vocal
never have
cords
thought of that.
are just little muscles, and they can get irritated very easily.
Right.
Excessive coughing,
Okay.
throat clearing.
And can that also be habitual too? Because it seems like I've known people over the years, it's like, are you really clearing your throat, or you just have this habit of
Right.
doing it?
I think
you know?
it's both, because I think
Okay.
they get a feeling that there's something there, whether there is or
Okay.
isn't. And it's horrible. It's horrible for your vocal cords because it slams them together,
Okay.
and then you run the risk of getting some type of a lesion on them.
Okay. What sort of doctors then would refer to you? Like ear, nose, throat
Ear, nose,
doctors?
and throat, pulmonary,
Okay.
internal medicine,
Okay.
neurologist. I
Right.
mean, just about anybody could refer to us.
And MS patients, multiple sclerosis, that would be considered a neurological, and they could come also for treatment?
Right.
How many people do you often treat per year?
Oh my goodness.
Per month?
Per month.
Multiply it out.
Let me see. Could be, I personally could do maybe 30 plus.
Really? Okay. And are they primarily of the senior citizen bracket? I know you said that you can start at age 2, but
I have an age range right now of 2 to probably 70.
okay. And is any of this genetic or familial at all, where it tends to run in the family? Especially I'm thinking for younger kids.
Could.
Okay.
Some does, some doesn't.
Right. How would you help then a person, for instance, that stutters? What would be an idea for that?
Stuttering is not my forte. There are
Okay.
stuttering specialists.
Okay.
So usually I would refer a stutterer out, or refer them if they're a child to the schools.
Okay. And speaking of that, I do yoga. I'm a yoga person. I teach yoga. I love yoga. And I have heard over the years that yoga really helps with stuttering because it helps with balance. And my husband has told me a story that years ago, he's from England, and when he was back home in England, he had a friend of his who had quite a bad stuttering problem. And this gentleman found, that when he would just gently lift up one foot, unnoticeably to the person he was standing there talking to, he'd lift up one foot, his stuttering would decrease.
Oh, interesting.
I know, and I found that fascinating, and I always wanted to kind of explore that somehow, but I never knew who I would talk to about it. But it must be something to do with, well, he said that he thought it was because he was distracting himself from the stuttering by
Right.
having to balance.
I bet that. I bet that's what it was.
I didn't know if it
Makes
was a
sense.
hemispherical sort of thing in the
I
brain.
bet it was the distraction, just like there are singers who stutter, or
Okay.
actors. But when
Right.
they're singing or doing their roles, they are as fluent as can be.
Wow,
It's a distraction.
that's amazing. That's the mind-body connection
Right?
right there.
Absolutely.
Yeah.
Now, Helene, would you be able to treat those who are singers because of your voice?
Because of voice?
Yes.
Yes.
That's what I was thinking.
We have
too.
treated singers in the past.
Treat them to improve their singing, or
Well, sometimes singers abuse their voice.
oh,
Actually, one of my most recent Parkinson's patients was a singer. She sang in the church choir. And her big problem was she couldn't hit the notes she needed to hit.
oh,
So we worked a lot on her breathing, and she had beautiful range.
okay,
And she was able to hit notes by the end of therapy that she had not been
Really?
able to hit in 6 months.
wow.
So
How was her follow-up? Did she continue to be able to
I
do
hope
it?
so. She just ended a couple weeks ago. So I think
You should
she-
write a book about all these wonderful ways you're helping people. Be interesting.
Very. And as I said, I was able to observe, and just even with this gentleman, I observed from the first treatment to the third treatment that I observed, I couldn't believe how much,
better.
yeah, the projection, and he had certain phrases, excuse me, that he would have to say, and he worked at a golf course, and so if he was answering the phone, he would answer the phone like this, and I mean, how
And
much,
project more.
right,
Again, it's
How much it
conscious,
had
being conscious of
improved.
something.
yes.
Yeah. Wow. Well, it goes to show really that when you have a specialty, there's a reason for that. There's research behind it.
Right.
That's why it becomes a specialty.
And
you
this,
know?
this
Right.
program prides itself on being an evidence-based
Okay.
therapy program.
Okay.
So it's evidence-based, it works. So
And how long has this, is it Lee Silverman?
yes,
LS?
it's been around a long time. I know I've been doing it at least 15 plus years. I bet it's been around 20 years
Okay.
at least.
Okay. And do you do the big part? You do the loud part?
I just do the loud part.
Okay.
The big part's done by a physical therapist or an occupational therapist.
Okay. For people that have similar neurological problems.
Correct.
But they have different maladies or different reactions to them, so a different specialist for that different area.
Right.
Okay. Now, we're going to be having some other specialists on here in the
Yes.
near future. Can you tell us about those basic types of programs that we can expect?
Well, we're going to be highlighting on our aquatic therapy program, and today we're going to be talking, as you know, about the LSVT. We do pediatric therapy, we do vestibular, and there's some other
Okay.
various ones that,
Vestibular ear disorders,
Yes.
right? Okay.
yes, and voice. We're going to
Okay.
highlight a little bit more on voice.
All right.
There's 8 different specialties that Botsford does.
Sports therapy?
Yes, sports
too?
therapy is, yes,
Okay.
at the various. We have 5 clinics, 3 in Novi, 1 in Farmington Hills,
Oh,
and then 1 in Redford.
okay.
Yes.
All right.
Can I add something?
Oh, please.
The most recent patients we've been seeing for the LSVT program have been newly diagnosed. So we're finding kind of early intervention is hopefully will prolong the disease from progressing.
Okay.
So kind of early detection is better. So we're seeing patients a lot earlier. In the past, I had seen somebody who maybe had Parkinson's for 10 years. Now I saw somebody who had Parkinson's diagnosed about 6 months ago.
And why is that? Just referrals are happening sooner in
I
the
think people are
situation?
getting diagnosed sooner.
Okay. I didn't know what the tests are that determine whether someone has that. Maybe there was an improvement in that, even?
Could be, I'm
Could
not
be,
sure.
could be
Okay.
because Michael J. Fox has Parkinson's,
Oh, and awareness.
and awareness
again.
is greater.
Yeah.
Right.
It could be. I don't really know. I just know people are getting diagnosed a little sooner,
Okay.
so they're getting treatment sooner.
Okay.
So
And maybe
they're-
they can detour some of the negative effects of
Right.
it by being treated sooner and
Right.
being more aware sooner.
And knowing what to do so when they do get worse, at least they have something to fall back on and not let their movements or their voice get to the point where it's
Right.
they just give up.
Right. That might help prevent a feeling more of hopelessness or
Right.
of things deteriorating.
Absolutely.
You know? Okay. And then how can people find out more specifics about the program or what have you? You have a website at Botsford, right?
We do have a website,
Okay.
and I'm not sure if LSVT's on there yet,
Okay.
But they can call any one of our clinics,
Mm-hmm.
and I don't have the number in front of me, unfortunately.
Okay. We
Where
might be
they
able to
would be
put
able
that on
to.
the
Yes,
show,
so
too.
I can definitely supply that, where they could call, and then that receptionist would be able to say, where do you live and which clinic is closest, and we'd be able
Right.
to
And then
put
you would
them with the specialist.
interface with their doctor, though, to get this prescribed, I'm assuming?
Yes, we would probably instruct them to get in
Mm-hmm.
touch with their doctor. That's what my job is, to go out and let the Botsford affiliated docs or, the Botsford owned physicians about the program. But
Okay.
if they go on like the website, LSBT, and like Helene is on there and our
Right.
certified specialist, yes, we could let them know what they would need to do to be able to access the program. Just getting a prescription. And the
Right.
prescriptions that I do give to the doctors has LSVT big and loud right on it, where all they have to do is do a check mark.
Okay, interesting. And how long has Botsford offered this specific type of therapy?
The
Quite a while.
LSVT loud, Helene has been doing for a number of years.
Through Botsford, too?
Through Botsford.
Yes,
Okay.
and the big has only been within about the last 6 months.
Right.
Oh,
It's much newer.
Yes,
interesting.
And Deb, you did make a good point about going to the LSVT website. Anybody who is a certified LSVT therapist,
Okay.
they are listed. If you put in your zip code,
Right,
a whole
okay.
list of people in the area will come up.
And what do they have to be before they get into that specialty? A speech therapist in general, and then
Just-
they
correct.
specialize?
Correct.
Okay,
A master's level speech pathologist,
okay. Wow.
and then it's a
All right.
specialty, specialty certification.
Okay. Well, I think that covers it. I think that we're going to have some interesting shows coming up then.
Yes,
that
we
will
will.
go into more details about each of these different types of programs.
absolutely.
And I'm excited about that. And the show will be able to put the contact information for Botsford on the bottom of the screen.
Right.
And again, people can call. And you mentioned Health Source Magazine too?
Yes, that's a community magazine that Botsford does put out. I'm not
Okay.
quite sure what the scope of the mailing is, but it's quite large.
Okay. All right. Well, great. Well, I want to thank you both for your time.
Thank you.
And
you.
all your wisdom and information. I know that you're clearly helping a lot of people. 30 a month or more?
Mm-hmm.
Wow.
That's just
Okay.
me, so there's other therapists too. So.
How many are there, by the way?
I have 4 speech pathologists on staff,
Okay.
and physical therapists, a lot.
lot.
A lot.
Right.
Okay.
Yes. Sorry we didn't come with those numbers.
That's okay. I'm a very curious person. I love to I think of questions as they come into my head pretty much. Yeah. All right. Well, I appreciate your time coming, and I look forward
Thank
to
you.
speaking with you again. And with that, we're
Absolutely.
going to close on Mature Matters today, and I look forward to speaking with you in the future.
Okay, thank you so much.
Thank you.
Thank you.